So her tumor, she was diagnosed originally about 4 years ago, and it has since recurred twice. The most recent one was earlier this year. And at her first recurrence, they were actually just recommending radiation to that spot and not doing surgery. But again, through conversations with other doctors across the country, they decided that the best route was surgery. So while we could have probably not done that, we trusted that opinion so much that we really didn't think twice about it. And we just proceeded with the surgery instead of just the radiation to the area. So I feel like in some ways, the first couple recurrences, there wasn't a whole lot of decision-making that we felt like we had to make. It was just kind of, okay, it's there, let's go take it out and let's do radiation. That has since changed a little bit since her last recurrence. So her last recurrence was earlier this year. We did have the surgery, and she did have more radiation to the area. And now we are starting to talk more about chemotherapy. That was something that has not been on the table in the past, and that is something that is not necessarily widely used for an ependymoma, but they have a couple of chemotherapy drugs that just came through trials and have shown some good success in helping to stabilize disease or prolong time to recurrence. And so now we are definitely in more of a decision-making process of where do we go from here? Do we proceed with radiation? Do we not proceed with radiation? Do we just continue to watch and wait? And I think that is where both Allie and myself, and I would say I am involved in that decision-making process of deciding where to go from here, though very much recognize that it's not my body and it's hers. And so ultimately it's her decision. But I can say that she leans on me for support and guidance, and we both view that this is something we're going through together. So I would say I'm involved in that process.